I see. So you're suspecting you of depression.
Yes, doctor. For months I have always found myself in a very sad state for no apparent reason.
John, a 27-year-old man, said with a look of disbelief.
Besides feeling sad, do you have any other symptoms?
I'm also often worried about a little thing, like the fact that I always have to go back and check that I have locked the door before I go out.
Kenzie nodded, taking notes attentively. But John's eyes gradually became cold, full of unnaturalness.
It seems that in addition to depression, you also have signs of an anxiety disorder. To understand better, let's dive into your emotions and behaviors, shall we?
Okay, but what I say will be kept private, right?
Of course, because it's my professional responsibility.
So, let's start with how hot-tempered I have become.
Hot-tempered? What do you mean?
I found myself unable to control my anger 5 years ago. Like when I was extremely upset because a boy on the street dared to glance at me.
John grunted, causing the air in the room to slacken, but his face was calm as if he was talking about the weather.
So do those feelings disappear quickly?
Oh, of course not. So I found myself another pleasure to relieve.
What did you do?
I killed a stray cat near my house.
What?
Let's see. How did I kill him? Oh yes, I made an incision from the neck down to close to its genitals. For a moment, I found myself really curious about the internal organs of a cat. I put my fingers inside the corpse that was still warm. Heart, lungs, intestines, liver. How warm those little organs are. And the red water in my hand suddenly became as beautiful as an art painting.
Kenzie felt the blood in her body freeze, her hands unconsciously clinging to the notebook, but she tried to keep her voice calm.
How often do you relieve yourself in this way, John?
No, but doctor, I want to ask, did what I just told you scare you?
I'm used to patients behaving unusually.
Now, hearing her answer, John involuntarily laughed madly.
I heard that doctors and patients should be honest with each other, right? Then, why is your hand bleeding?
Oh, Kenzie was startled, looking down at her hand. She realized that her fingernails had gotten so deep into the notebook that they were bleeding from the edges of the paper.
I also have to be honest with the doctor that I lied.
What are you lying about?
My tantrum didn't start 5 years ago. It started when I was 15 years old, when I killed a 13-year-old girl on the edge of the forest.
Dr. Kenzie was stunned and couldn't believe her ears, her eyes blooming again as some vague fragments of memories appeared and disappeared from her mind.
Do you understand that what you just said is serious?
John tilted his head, his expression as if he wanted to tease his prey.
I understand, so I buried the body very carefully.
Then can you tell me more details? What did you do to that little girl?
Curious, isn't it, doctor? I love your reaction. It reminds me of that 13-year-old girl, but the good part is still waiting. Don't be in a hurry.
John, do you intend to hurt anyone else?
I don't know, but if the game sounds good, I can't wait to play it.
John slowly approached Dr. Kenzie. She involuntarily stepped back, her eyes constantly leaving him.
You know, the look in your eyes reminds me of how excited it is to be with that little girl. It's been a long time. Anyway, see you at the upcoming therapy.
Saying that, John straightened up, smiling excitedly. He turned and walked to the door, slowly closing the door with his eyes always looking inward, as if he couldn't leave. Kenzie stood still, cold sweat running down her spine. A vague fear loomed, but she couldn't take her eyes off the door that had just closed.